Hello everyone and welcome to the Pediatric Hotline. Today's presentation will cover constipation in children. I would really appreciate it if you would give me a thumbs up and consider subscribing to my channel. Thank you. So constipation in children is a common condition, and this is something we see quite frequently, if not every day, in pediatrics. This occurs when you are unable to stool regularly or on a daily basis, and your stools are usually large and hard, and they're difficult to pass. So some causes of constipation in children most commonly are the following. Firstly, the diet. Usually this is because the child's not eating enough fresh fruits or vegetables which have fiber. Fiber is a substance that actually is insoluble in water or not digestible. So as it passes through your digestive tract, it is able to push waste products out of your intestines so you can eliminate them in your stool. If you're eating too much meat, dairy, bread, or processed foods, you're not going to get the proper amount of fiber because they're very lacking or low in fiber in those foods. Another cause of constipation in children is dehydration. So if you're not drinking enough fresh water, or you're drinking too much caffeine or dairy, caffeine is a diuretic. It makes you pee a lot, so you lose fluids. So the stool, as it's passing through your digestive tract, it dries up and you can't pass it. Lack of activity is also another reason. Or your child may have an underlying medical condition. For example, children who are on the autistic spectrum usually have a very small range of food products that they like to eat, such as pasta or breads, which both are constipating. So symptoms of constipation include very large or hard stools, or the stools may appear as small marbles or pebbles. You may have bright red blood in your stool from straining to poop, and little tears can occur in the skin around the anus, which causes bleeding. Abdominal pain, vomiting, loss of appetite. Headaches may occur because a stool sits in your colon and is unable to be passed. It's actually toxins can build up in your body and cause a headache. And if severe cases of constipation can occur, this may make the abdomen look large or distended. So treatment for constipation is usually something that is short-term, and constipation can easily be corrected in children who do not have an underlying medical disorder. First things, a high fiber diet, plenty of fresh fruits and vegetables daily. Pears and grapes are an excellent source of fiber. Reduce breads, pasta, rice, dairy, and meats in your diet since they are lacking in fiber. Plenty of exercise and movement, and keeping well hydrated is important. Add more water to the diet and reduce caffeinated beverages and dairy. Some additional treatment includes the following. For acute constipation, this is usually short-lived. If you can incorporate changes in your diet and use some other methods which are below, it usually can correct the constipation. So an enema or a glycerin suppository in infants or toddlers. Now, infants can get constipation if there's frequent formula changes, or sometimes a breastfeeding mom will have certain foods in her diet that may cause constipation in the infant. A daily laxative, Miralax, can be used in children until the stools are soft and they occur on a regular basis. Other laxatives are not recommended to be used regularly and need to be managed by your pediatrician, which we'll discuss in the next slide. So long-term treatment is usually needed in children who have an underlying medical issue, such as what we mentioned earlier, children who are on the autistic spectrum. So a lot of these children need to be on a daily laxative for a long time. There is a disorder of the nervous system called Hirschsprung's disease. It's usually corrected by surgery, but these children also may need daily laxatives as well for the long term. You shouldn't give your child Pepto-Bismol, stool softeners, or other laxatives without the supervision of your pediatrician. Giving children something over the counter to help them poop or to stop diarrhea or anything that interferes with the stooling process can cause electrolyte imbalances as children. Hence, this needs to be supervised by a pediatrician. Okay, that'll do it, guys. Thank you for watching the Pediatric Hotline. I hope this was helpful. If there's any topics you would like to see covered on this channel, please comment below. Have a healthy and wonderful day.